Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare.
Welcome to Boombostic Health in the Wild. We're here at the Diagnostic Zone at the Health Conference in Vegas, and I'm super thrilled to have Lathe on here from First Data Bank in a very specific area of First Data Bank that we'll dig into that's bringing transparency to the prescribing process. And you're all the way in from Phoenix. Well, I'm in from Chicago, and we also are headquartered in Indianapolis. It's great to have you here. This is episode 47 of Boombostic Health. And we do this series called In the Wild, where we go on site. And in this case, we're the exclusive podcast within this new diagnostic zone, which is a really awesome new component of the health conference, which really this has turned into the biggest event of the year. The energy is amazing. Like I won't name names because I don't want to disparage any other conferences, but sometimes you walk into a conference and you kind of feel like you're walking into a funeral or something. And this thing, like you walk in and the music's pumping and the energy's here. I think the cool thing is it's a real ecosystem kind of play. It's not just one specific niche. And so we're in this whole ecosystem. And I'd love to hear what you're up to within your specific area. But maybe we zoom out for a second. Cuban was here obviously yesterday and gave kind of a headline speech and, F PBMs and F this and F that, and we need better transparency. And so there's a lot of focus that's going on, even all the way up to the federal government around this whole issue with prescribing. It's too opaque. It's too expensive. It's, somewhat almost like shady, some of the stuff that goes on. Would love to hear your perspective and help our audience understand better. Why is there so much focus on this?
Well, that's a great question. I think, look, we're witnessing firsthand ourselves, sort of a revelation, I would almost say, in the sense that the patients are fed up. They're fed up with the prices they're paying for prescriptions. They're fed up with being confused. And I think the generation, especially the older generation right now, so many of their kids that are taking care of them and managing prescriptions and managing prescription costs is so frustrating in this country. And so I think enough is enough. We need more access to devices. We need to know whether it's in our benefit, whether it's not in our benefit, what are our options? Because I think we're so programmed to think that, well, we have insurance, right? Well, I guess I have to use insurance. You don't have to use your insurance. You don't have to do it. You can access coupons, you can get price transparency in other ways. If the price is better with insurance, great, do it. We need that openness and that visibility so we can make choices. Because if there's one thing we've gotten really good at in this country, we know how to shop. We're good at it.
Right. Yeah. Thank you, e-commerce. So when you talk about patients, people, consumers being fed up with prescribing, let's just use the example of somebody who is, let's say 60 years old and they're on 10 different medications that they've been prescribed from 3 different places. And like, how have they generally gone about getting their prescriptions? And how does what you're talking about, about making it better, fixing the problem of what people are fed up with, how should it work?
I think it needs to be more of an open market opportunity rather than forcing limitations. Because that's, I think, what we've done. I think in many ways, we're trying to design healthcare to meet the needs of a patient. But when you have a specific coverage plan, a PBM, it manages that patient. And we all know that PBM has certain contracts for manufacturers, pricing on certain drugs. And I think it's a way to have that benefit. It's a way to have coverage, but there are alternatives out there. And I think the problem is patients just don't know that. With my father-in-law, we were having a conversation and he was expressing his frustrations around it. And I said, you don't have to use your insurance. You can pay cash. It's almost like he didn't really understand that. Because here's the problem, and I think we've all experienced it, if I may. Anytime I get a prescription, I go to the pharmacy, and when I pull up, I'll usually use a coupon. I'll look, after I get my prescriptions, the doctor writes it, I'll look it up on, BuzzRx or GoodRx or something. As soon as I pull up to the pharmacy, I end up with the exact same reaction every time. The pharmacist is annoyed with being reached because when they got the prescription, they already billed my insurance. They just did it. So I pull up. I said, well, no, I don't want to use my insurance. I want an easy coupon. Give me the eye roll, and they say, yeah, it's come back in an hour or two if it's not back it all out.
It's the default that the reflex is you have a prescription coming in. The pharmacy assumes that this should run this way. Now, there's this other issue, I think, which is the fox is guarding the hen house in some of these cases, right? So you've got the PBM, you've got the drug companies working with them, you've got the pharmacy business that owns the PBM, you've got whatever network they're using. Maybe SureScripts is one that comes to mind, which is so vastly deployed that there's a concern, candidly, as it relates to the amount of risk that exists with just having this one network. We talked a bit earlier as we were preparing about the company that had the huge revenue cycle disaster, Change Healthcare, and that brought the entire U.S. healthcare system to its knees. Do you see that same kind of risk that exists within the prescribing network world?
I mean, getting much better. I know that I like to think that everything's secure. These things won't happen to me. Just today I got it this morning. What did I read? AWS went down. That's shocks. That's surprising. So,
right, was it just one availability zone, or when you say AWS went down?
Got all the details, but it was all over the news, and it was a big deal. And I'm like, what's going on? Going to create a prescribing net version, bring it to market. We looked at two key things. One is we wanted to make sure that we met the market where they are, but they had access to all the prescription detail, the standards, and everything that's out there. And then we wanted to make sure that we were innovating in this space because, to be honest, the e-prescribing hasn't changed much in 20 years. But just fundamentally, it's the same. It goes down. Those 5 billion transactions draw to fax. Now, tell me how the retail pharmacy is going to manage 5 billion transactions. And look, there's a difference between an outage or a breach or ransom, which is what happened to Change Healthcare.
Right.
Change Healthcare couldn't get access to their own network for months. Pharmacies just could not keep up with it. And so it's not so much, I don't want to create a doomsday situation, but the reality is we can prevent that. We can prevent that by having a redundant network in place. So that's exactly what we're doing is Vila is available. We're connecting to retail pharmacies nationwide. We're connecting to EHRs, health systems, and all with a purpose. We're not telling people, don't use SureScripts. That's not it. You don't need a redundant network because one of you goes down, you can immediately have access to another network. Transactions continue to flow.
And is that something that's happening today? The Vila network, you're working with certain players that are SureScripts users, and then they're using Vila as the backup. Is that right?
Yeah, there are some of those scenarios. Most of our partners is what they're doing is they're routing all the traffic that they can go through Vila to our retail pharmacies through us. Here we'll have upwards about 85% of all retail pharmacies live on Vila by probably next year.
Well, and I think those are the kinds of pharmacies that Mark Cuban's Cost Plus Drugs works with as well, isn't it? The smaller, kind of more independent, not the big chains.
The big chains only make up for what must have it to market.
Right. Yeah.
Small independents out.
Yeah. No, it's kind of like the lab market. Everybody thinks that it's all LabCorp and Quest, but in reality, there are thousands of labs. Every health system has a lab, lots of independent labs. It's the same thing here where you've got lots of different players in pharmacy. So how does what you're describing interplay with what you raised about using a coupon or getting the lowest price? Or so is it that when you execute the pharmacy that's using your network, when they're using your network, it's a better price? Or how should the patient think about this? If there's a person listening to this right now that is somebody who their loved one is getting a lot of prescriptions, or they are, how does Vila help their world be better from a dollars and cents perspective?
I'll tell you what, a doctor, a physician, and a pharmacist, they should never know who Vila is. So Vila is a network. We're in the background. We're doing all the work in the back. If you think back to the good old days when you used to look at your doctor 25 years ago, when they look at your prescription, they put it on a piece of paper.
Right.
And you
How did anybody read that? Right. Yeah. Yeah.
Go to Aegis Pharmacy, you want
Right.
at that point. When we created the prescribing process, we looked at all the digitation process and we said, let's just link the patient out of it. But now, maybe in late 90s, early 2000s, that was the right thing to do. We didn't have access to a lot of technology yet. But in 2025, every person has a cell phone. And there are fantastic consumer consumer prescription management platforms and apps out there today. So what Bigler has done is people can prescribe them differently. Rather than require a patient to choose the pharmacy up front without any decision support, because that's what we do today, right? You go to the order, sure, for cents. I don't know what's next to my house.
Yeah.
I have no idea what the prices are, what the costs are.
Yeah.
So what Bigler does is we enable not only pharmacies on a network, but we enable apps.
Okay. So you're powering behind the scenes.
We're not an app, but we
Right.
an app. He says, "Oh, I don't know where I want my script filled, so go ahead and send it to GoodRx system."
Right.
Of the prescription hold securely in the network. We have an API with GoodRx. We notify them. They notify the patient. The patient goes into the app experience. They look at all pricing options. They get educational material. Now they have higher choice and if they have sequence support. That one of the select farms want to fill that. The API tells people what they want it, route it, route that directly on as a new RX.
Okay.
The way it was templated in the first place. Pharmacy doesn't know the difference, but the patient's happy, they're managing their prescription. And we even have fail safe. So let's say the patient selects an app and it goes through the app and the patient doesn't do anything. Well, in an hour or 3 hours, whatever time on the app wants it said, we'll drop to a default box.
Right.
Make sure it gets stumbled.
Okay.
That patient gets that.
Okay. That makes sense. So it's really builds upon the first data bank history of having the information that powers healthcare, right? It's interesting. We've got a company in our Health Cloud Capital portfolio called Decision RX, which isn't focused on primarily on the price of medications. It's focused on the efficacy of medications for a particular person, in particular high risk people. So it's focused on more of the ACO risk bearing kinds of entities. But I'm fairly certain, have a partnership with another area of First Data Bank. And our pharmacists are actually helping to power this process to get patients on the best possible medications. So when I hear you talk, it's like if all of this worked in the optimal way, patients would be getting access to the best medications to make them healthy, obviously. People take that for granted, but it doesn't always happen. But on top of that, what doesn't always happen is the choice related to where I will get this filled and what that price is and all the funny business that goes on behind the scenes with rebates and all of this sort of bullshit, candidly. I think it sounds like you eliminate all of that and you're powering that network.
Exactly. We are no sit in that game. We are Switzerland, and we just want to provide as much transparency and education to the prescriber, to the patient, and to the pharmacist.
Okay. Okay, very cool. And how did you get into this? Like, you obviously are very conversant in this. Were you a pharmacist or something, or?
Healthcare tech, 27 years now. And it is in 2010 that I started working in the e-prescribing specific space. And I've been for 15 years now trying to do exactly what we're doing now.
It's interesting.
Fighting this out to create a competition in the space, to create options, redundancy, and transparency.
Okay. And where is your business headquartered? I know you're in Phoenix, but everybody's virtual these days, it seems like. Where's the mothership?
So DB Motion is in San Francisco.
Okay.
We have a large office there, and we have a big office in Indianapolis as well.
Well, that is great news because our headquarters are in Indianapolis. Okay, so importantly, being in Phoenix, are you an ASU fan?
I am.
They had a hell of a game last week.
In fact, my son's, my son and my daughter, they're twins of both ASU students.
Rip.
I wasn't there. I was traveling.
Well, my Hoosiers, as we talked about earlier, have become a pretty decent team as well. Have you heard about that at all? It's still wild because I love watching College Game Day, and you used to watch it and just like hope that they would mention Indiana. Now they have like a whole feature on what's going on, and ASU is in that same boat. So, well, really awesome having you here on the Boombostic Health podcast. Super awesome to meet you. Anything else you'd like to mention before we kind of wrap up about the show or things that you're focused on?
We covered most of the points. Thank you for the time. We're just glad to be here and appreciate the evening.
Absolutely. Thank you so much. And thank you everybody for being here for episode 37. This is the first in a series. We're going to be knocking these out throughout the entire health conference here. And really excited to kick it off with our first guest, Lathe. Have a great day. We'll see you soon.